Hi, I am Hanif Hanafi, and today I will present about a topic that I have combined on my pitching and my PS into one. So today I present to you PrEP as preventive treatment for HIV and how to practice safe sex among LGBTQ community. The objective of this presentation is first, I will focus more on LGBTQ community. Second, I will explain about PrEP, and third, I will explain about safe sex. The benefits from this presentation is we able to reduce the HIV cases in Malaysia and also to decline in the number of reported AIDS-related deaths. The purpose of this presentation is first, I want to inform the public, especially LGBTQ community, the importance of taking PrEP as preventive treatment for HIV, and also I want to educate the public on how to practice safe sex no matter what is the sexual orientation is. What is PrEP? Okay, based on the picture that you have seen on your right, I guess it shows the box of the medicine, the PrEP medicines. So PrEP stands for pre-exposure prophylaxis. The word prophylaxis itself means to prevent infections or disease. PrEP is a new way for people who do not have HIV to prevent themselves from becoming infected by taking a protective pill every day. This pill called Truvada contains two medicines that are used to treat HIV. If someone takes PrEP and if they are exposed to HIV via unsafe sex or unsafe needle use, these medicines can work to keep the virus from establishing itself inside the body. PrEP is an effective HIV prevention strategy in population in which HIV testing is common. This is the recommendation for or against using PrEP. Testing regularly is essential for its success. So, who should take PrEP? PrEP should be taken by people who have HIV negative or at substantial risk for HIV infection. These include HIV negative people who are ongoing sexual relationship with someone who is living with HIV. Second, MSM, men, sex men, and other key population who have sex without a condom who have been diagnosed with a STI within the past 6 months, and also people on PrEP remain under medical supervision and test for HIV every 3 months. PrEP can affect the kidney function. So kidney function should be conducted for those who on PrEP. So for the person who has taken the PrEP, they will be under supervision of the medical health provider, the under health medical health provider. So when they come to the clinic, we will take their blood, and one of the blood is kidney function test, or we call it as liver function test, LFT, to monitor the reading of the kidney. So how to practice safe sex? Safe sex is all about protecting yourself and your partner from sexually transmitted infection or STI. Safe sex helps you stay healthy and can even make sex better. Safe sex is sexual contact that doesn't involve the exchange of semen, vaginal fluid, or blood between partners. Safe sex practice aim to reduce the risk of sexual transmitted disease and infection, because sex always involved with some risk of disease such as and there is no such thing of safe sex. The example that I can give to you is for chlamydia or gonorrhea and syphilis. So using condoms when or dental dams when having oral sex. So oral sex is where the mouth of one person is placed on the uh, vaginal opening of one another. Oral sex is not a risk-free sex practice, because a person comes into contact with another individual bodily fluids, while the risk of contracting HIV from oral sex is likely lower than that of the penetrative sex. A person can still get the STI, including herpes, chlamydia, and gonorrhea. Does it meaning that if you are doing the oral sex, you will not get the what we call that, the infections, the sexual transmitted diseases like chlamydia, herpes, and gonorrhea, just because it does not involve the bodily fluid, not like lower risk of bodily fluid, but you can still be infected by the STI. So using condoms when vaginal sex, or you are doing the anal sex, doesn't matter if you are doing the anal sex or vaginal sex, you still have to use the condoms. So tips that I can give to you for safe sex is first, barrier method. Second, no contact sexual activities, non-penetrative sexual activities, immunization, medication, treatments as prevention, limiting sexual partners, undergoing regular STI testing, and the last one is communicating openly. So barrier method, the barrier method that I can give to you is using the condom. Barrier during sex aims to prevent direct contact between each partner's genital by limiting the exposure to bodily fluids. Latex condoms are barrier worn on the penis during intercourse. So, non-contact sexual activities. No contact sexual activities are sexual experience that do not include physical touch, eliminating the possibility of fluid transmission. Example for the non-contact sexual activities are including the phone sex, sexting, mutual masturbation, and cyber sex. So, non-penetrative sexual activities like making outs, hand jobs, and fingering limits partner exposure to each other's bodily fluids, reducing the chances of STI transmission as compared to high-risk activity like vaginal, oral, or anal sex. However, non-penetrating sexual practice do not protect against STI transmitted through intimate skin-to-skin contact like herpes or syphilis. So, for the immunization, you can reduce the risk for STI like hepatitis B and HPV for women by being immunized preventively by a licensed healthcare provider. So for the medication, for pre-exposure prophylaxis or PrEP is a method of taking specific prescriptions drugs to reduce the chances for HIV infection. The most common PrEP use a combination of tenofovir and emtricitabine and should be only taken under the direction of the healthcare professional. These drugs have been proven against HIV transmission but cannot reduce the risk of other STI. So treatment as prevention. Treatment as prevention, sometimes called as U or is a method of limiting the transmission and spread of HIV by treating people living with HIV with antiretroviral medication such as PrEP. So limiting sexual partners. I know that maybe some of you, it's hard to not to have multiple sexual partners, but it's for your own good. So you have to limit the sexual partners. Undergoing regular STI testing. This is the thing that I want to address here. That no matter what is your sexual orientation, if you are straight or you are gay or lesbian or transgender, please do regular STI testing like every 3 months to 6 months every year so that you know your status. Communicating openly. Practice open, honest sexual communication with all partners before having sex. So, steps to reduce HIV case in Malaysia. So, first, harm reduction. Population size will be re-estimated and its geographical distribution map and program implementation adjusted to the priority locations. Distribute free PrEP to LGBTQ community and also to heterosexual. I know that the words of free PrEP, it's controversial to some of us, but we want to reduce the HIV cases in Malaysia. So do not take it too hard when you heard the word free PrEP. So government cooperate with more NGO to do free HIV or STD tests, free testing in all government health facilities, sexual transmission, okay. For the young people, the multi-partner national task force on HIV and AIDS for the most at-risk young people will be dedicated to prevention of HIV and to care of young persons living with HIV and AIDS. Because somehow young people, they are not hot blood. In Malay we call darah panas, and I do not know maybe the direct translation of darah panas is hot blood. So they are eager to explore more. Young people, they are tend to experience, to like broaden their horizon. So stigma and discrimination. Avoid discrimination towards community. Self-stigma is common among people living with HIV and requires intensification of psychosocial support. So this is the prevention of STDs or STI that I want to educate to people. First, abstinence. Yes, to save sex for marriage. Second, no to premarital sex. If you are gay, you are not straight, I want to advise you, please do not get married because you might hurt your wife's feeling. You married to a woman, but you having an affair at her back with a man. So it's not a good traditions. B. Be loyal. No to multiple sexual partners and no to extramarital marriage. C. Condoms. Prevent most of STD and pregnancy. And D is the drug. HPV vaccines against HPV infections and cervical cancer. Pre-exposure prophylaxis PrEP for HIV and treatment as prevention of HIV undetectable to untransmissible, U equal to U. So the thing that I want to address here is PrEP and safe sex is interrelated to each other. Doesn't meaning that if you take PrEP and when you do not wear the condoms, you will not have the HIV, but you might still get the STI like herpes, gonorrhea, syphilis. So please practice safe sex, and if you are sexually active, please take PrEPs and also wear condoms. So that's all from me. Thank you.